Hello, everyone. This is Dr. Spinach, and today is fifth day of PLAB-2 Video Sprint Public Accountability Challenge. Today is day 5 of 15, and today's topic is just a minute. PLAB-2 marking system explained. You need to know this. Now, let's begin this by understanding how examiners mark you in this in PLAB-2 exam directly through GMC website. And this is something probably no one explains you, but if we go into the GMC website, we exactly understand what is it that they are looking for. So let's get started. Okay, here we go. Now, if you go to General Medical Council website, it's over here, and you go to PLAB2 guide. On the number 3 count, you will find how will you be tested. Now, this is where you have to get yourself a read. Now, let's go down and understand it by breaking it down into steps. Okay, so there are 3 domains that PLAB2 examiners mark you on, and every one of us know it. But what do these domain cover, and what are the things that these PLAB2 examiners are looking for, that GMC is looking for in you as an FY2? Now, these domains include data gathering, technical and assessment skills. That comes under one. Clinical management skills and interpersonal skills. Now, let's read through what this domain covers in order to understand what are the things that you're marked on. So, data gathering, technical and assessment skills include history taking, physical examination, practical procedures, investigations leading to diagnosis. So, before the diagnosis, everything you do will come under data gathering. So you take the history, you do the physical examination or practical procedures, you do the investigations, you do the eyes, everything before the diagnosis comes under data gathering. Now, moving on to clinical management skills. Now, everything from the diagnosis will be covered in the clinical management skills. So, formulating a diagnosis. So, how did you formulate a diagnosis and how did you explain this diagnosis to the patient will come under clinical management skills. And finally, formulating a management plan also comes under clinical management skills. So, it's not just delivery of the management plan, but how are you delivering it? How have you formulated it, laid it out, is also something that examiners mark you on, right? Except for the management also should be correct. And finally, interpersonal skills. Sometimes we as PLAB2 candidates do not understand that what interpersonal skills usually cover, and we have like a misguided idea that okay, maybe empathy is something that is covered, listening is something, but it is more than that. If you go through this marking criteria and what the domain covers, you will understand that interpersonal skills covers how you approach the station, whether you have established a rapport with the patient, and how have you used the open and closed questioning as well? Have is this a doctor centered consultation or a patient centered consultation? So involving the patient and demonstrating your professionalism and understanding of the ethical principles. So all of these things are covered under interpersonal skills. But let us go a little bit more in details on these. So, um, so there are a number of skill areas that the examiner assesses you on, right? Let's start with the interpersonal skills part because we are already discussing about that. So, what are the other things that the interpersonal skills, uh, domain assess you domain covers? So, I'll just read it through. Examiner tests you by observing the interaction between you and other person, usually a stimulated patient, and sometimes it may be an examiner. These interactions can take place in person, in writing, example, a prescription, or via a telephone call. Now, this telephone call can also be and can be an audio or a video call. The examiner will assess your approach to the patient throughout the examination, even if they are not present in the room. So the first thing that you should do uh, in when you are entering the cubicle is, see, in under clinical examination, they have written that you should begin each station by confirming your name and GMC number. This is important as the examiner may not always be present in the room and may be watching remotely. So, whenever you're starting a station, when you're practicing it, it is important that you start with, "Hello, I'm Dr. Spinach, and my GMC number is," yeah, or "Good morning, good evening," whatever the time of the day is. "My GMC number is XYZ. All right. Now, going back to the interpersonal skills, now, what are the things that are included in this? So, everything is included in this, but how you're communicating to the patient is important. Explaining the diagnosis, investigations, and treatment. Involving the patient in decision making. That is what I said. In the UK, it's not a doctor centered consultation, it is the patient centered consultation. Are you asking them, checking back with them? Do they understand it? Or is there anything else they would like to share? They would like to give their views on whatever it is that you have given as a management. So, communicating with the relatives, communicating with healthcare professionals, breaking bad news, providing clear, legible written instructions where appropriate. For example, prescription. Now, interpersonal skills under prescription is what? That have you written it everything clearly or not? Is it very easy for the other person to read or not? So again, in that case, you will have to improve on your handwriting. And how can you do that? Well, speeding up your practice, speeding it up. So that will come with practice. Seeking informed consent, clarification for an invasive procedure, or obtaining consent for a postmortem. This also comes under that. Dealing with anxious patients or relatives, giving instructions on discharge from hospital, and giving advice on lifestyle, health promotion, or risk factors. Now, they have not only covered how are you communicating in these cases, but they have also told you that these are some types of things that may come under PLAB-2. So we do practice these under PLAB-2 stations, right? But it's sometimes just under one station. We have a lot of things. For example, giving instructions on discharge from hospital, giving advice on lifestyle, health promotion, or risk factors. Sometimes it is a part of multiple PLAB-2 stations, multiple consultations. So how you are doing that is comes under interpersonal skills, and it also tells you that this is something that is a part of the station. So they have also told you what kinds of stations can come, and what is covered usually under one station itself. All right. Now, when let's say sometimes in some cases you do have to tell the examiner what you are doing and why if there is an instruction there on your role play card. All right. And again, the other thing is you have to consider whatever the anatomical model that is in front of you. Let's say you have to take, you have to do the venipuncture. So in that case, you have to consider that anatomical model exactly as a person that you're treating. So as if it is a human. So you look at towards the patient and you do the and you do your practical station there, right? And if there is no patient, still you have to consider that this is a real human being, and therefore you should not do anything that is unsafe or painful for a real person, because if you do that, that is also something that examiners watch you, and they will reduce your marks in that domain. All right. Now, we have covered interpersonal skills. What are the other skills? That is clinical examination. Now, well, so in some rooms, there will be telephone consultations. Now, this is something that they have warned you as well, that if there is a telephone consultation, then you should not touch or anything there, or you should not put your finger onto like, okay, calling in progress or something like that. If you, because the call is already in progress. So do not touch it. Otherwise, you may get disconnected with the call. Now, from here, we understand what are the clinical examinations. You will be assessed on day first, you will be assessed on your ability to conduct a physical examination of the stimulated patient or using a model or a mannequin. They expect you to carry out any basic physical examination, including but not limited to what are the examinations they are covering here: abdomen, breast, chest, hand, heart, and joints. You must be able to perform a rectal or bimanual vaginal examination, and you must also be able to use appropriate equipment in carrying out an examination of the ear, eye, or nervous system. So they have covered all the stations that you should be practically good with. Sometimes you also, so they are talking about Siemens now. So high fidelity in stimulator is the Siemens station. So how are you performing an examination or any other procedure on the semen? That is also something that they assess you on. Now, when we come to practical skills, these are some of the practical skills that they will assess you on. So have a read. I'm not going to read it line by line. You can go to this website and have a read for it. Now, we have covered what will you be tested on, right? Now, in our next video, what we will do is we will cover the 12th point, that is understanding your results. Now, even if you have not given your exam, understanding your results, this part gives you an idea of how examiners mark you on what, well, subdomains from these domains. So these are three major domains, and then there are many subdomains. So we will cover that in our next video. Now, that's all about my video today. I hope you gain something out of it. Well, reminding you again of the PLAB-2 birthday bootcamp that I'm going to conduct from September 1st to September 7th. This is a very special bootcamp because it's, well, related to my sentiments and a long time, well, you say, dream of conducting something like that. And I have been, well, delaying it for a long, long time. And I'm still preparing for it. I'm putting great efforts to it. So, well, if you want to join this, and I must say you should join this, please send me an email or a message on Instagram. So this is going to cover all the major stations like general history taking, psychiatry, ethical, counseling stations, well, prescription stations, semen stations, and teaching stations. And the classes will be around 60 to 120 minutes of your time. And there will be practice sessions with other co-doctors where I will help you with them by giving you a little bit of feedback there, as well as quick Q&A sessions. I'll also add you to a VIP WhatsApp group for ongoing support. Um, well, I'll sign up now because it's already going to start. So that's all about my video today. If you liked it, please give it a thumbs up and do share it with your friends who might benefit from it. And leave a comment. What is it that you have learned today? What is something that you think was, well, it will help other people as well when they are watching and seeing the comments that, okay, this is something that is crucial that they have learned and they can learn from you as well. And subscribe to my channel if you have not already done so. And, well, click on the notification bell so as soon as I post a new PLAB-2 video, you will get notified. Okay, well, thank you very much. Signing off, Dr. Spinach.